Millions of surgeries are performed on a daily basis, but yet some surgeries are deemed to be extremely dangerous that can leave the patient with irreversible or debilitating complications and even death. Even with modern medicine and advances in technology, there are surgeries that need to be done, but there can be full of risk and complications. So does the surgery outweigh, all the negative or complications that it can go through? A lot of people will say yes, they're willing to take the chance. So this is the top 10 most complex surgeries. Starting off this list, like we always do, in at number 10 with the 4-day-long operation. Gertrude Lewandowski underwent a 96-hour procedure in order to remove a giant ovarian cyst. She weighed 616 pounds before the surgery, and after the life-saving surgery, she weighed 308 pounds. That is remarkable. During the complicated operation, surgeons tapped the cyst slowly to drain the fluid because they wanted to prevent drastic drop in pressure that could have affected her heart. It took 4 days to remove 200 pounds of fluid out of her body. That is insane. This is believed to be the world's longest surgery, and with such a long surgical time comes many risks and complications. And now moving into number 9, we're talking about the baby who was born twice. What? 6 months into this person's pregnancy, the parent discovered that their unborn baby had an enormously large and deadly tumor growing out of her tailbone, and it was draining the baby's blood supply. In a very rare and risky procedure, surgeons put the mother under anesthesia. They moved her uterus entirely out of her body and they opened it. They removed 80% of the baby, leaving only her head and torso outside. During this 4-hour procedure, surgeons had to quickly remove the tumor because too much exposure to the air can send the baby into cardiac arrest, and they want to avoid that at all costs. Once they were done, they returned the baby to the womb and they closed up the mother. So the baby was born in that instance, and then the baby was born again 10 weeks later, and she was born perfectly healthy because of that operation, the life-saving operation. Coming into number 8 spot with the esophagectomy, this is a surgical removal of all the parts of the esophagus, or also known as the food pipe. This type of surgery is usually done on patients who suffer from esophageal cancer, and it is normally done to remove cancerous tumors from the body. This surgical procedure comes with a large assortment of risks and major complications, occurring in about 10 to 20% of patients, and some sort of complications, minor or major, occurs in 40%. Surgery in utero takes us into number 7, or commonly known as fetal surgery, involves performing surgery to treat birth defects in fetuses who are still in the uterus of the mother. Kylie Bolan was 22 weeks pregnant when doctors operated on her unborn child in order to repair a very rare condition in which bands had wrapped around the baby's ankles, cutting off blood supply to the lower leg. So surgeons inserted an operating telescope into the womb and used a laser and electric current to cut the bands on the baby's left leg. The baby eventually was born prematurely, but both of her legs were saved. Now, how complicated did that sound? Number 6, we have conjoined twin separation surgery. Sometimes identical twins are joined in utero, and surgery is needed in order to separate the two. There are instances when the surgery is rather simple. However, there have been cases that are downright complicated and highly risky. Take for example these two twins, Eva and Erica. They underwent one of the riskiest separation surgeries ever performed. They shared a digestive system, uterus, liver, bladder, and a third leg with 7 toes. The surgery was expected to be an 18-hour-long operation that involved 50 orthopedic, plastic, and urology surgeons, so there was a 30% chance that one or both of them wouldn't make it, and I mean those are pretty high numbers. Both will be missing vital body parts, and both will need significant reconstruction. Thoracic aortic aneurysm surgery comes into this list at number 5. For patients suffering from an aortic dissection, which is a tear in the deepest layer of heart that can cause many hazardous complications such as heart failure, need this surgery to repair the aorta. However, the surgery often involves in complex maneuvers that can result in many complications to arise, such as a heart attack, irregular heartbeats, bleeding, stroke, paralysis, graft infections, and even kidney damage. Hemispherectomy makes this list at number 4. This rare and complex procedure involves one cerebral hemisphere to be removed, disconnected, or disabled. So essentially, this procedure removes half of the brain. A 6-year-old underwent this operation because it was considered to be the best possible treatment for her epileptic condition. This is a drastic and complicated surgery that could have left this little girl to have been paralyzed on her left side. side. However, doctors determined that typically the remaining half of the brain takes over many of the functions that were originally performed by the removed half, and there's usually no effect on personality or memory. That is just simply amazing. Moving into number 3 with facial transplants. This is a medical procedure that replaces all or a part of a person's face using tissues from a cadaver. However, this procedure consists of a series of operations that require rotating teams of specialists. Let's take a look at Pascal Kohler's facial transplant. He was suffering from a rare condition that caused him to have disfigured tumors all over his face. He had previously underwent numerous operations to reduce the size of the tumors, but he was still unable to eat and he isolated himself. So finally, after a 16-hour operation, he got a brand new face. He was the third person to have had a successful face transplant done, and this was way back in 2007. Imagine what we can do now. I believe that first ever head transplant is happening this year, 10 years later. And doctors said back then that was the most extensive surgery. Number 2 brings us to a craniectomy. This is a surgical removal of a portion of the skull in order to relieve pressure on the brain. This is a very dangerous operation because it can result in permanent, irreversible brain damage. The patient can also suffer from loss in vision, mobility, and memory. Infections such as meningitis or brain abscess can occur post-operatively, and for these reasons, this surgical intervention is often seen as controversial because of so many things can go wrong. And finally, in at number 1, we're talking about the head transplant, like I mentioned just moments ago. This surgical operation involves decapitating the patient and replacing their head with a cadaver. This operation has been successfully performed on dogs, monkeys, rats, although those animals were unable to move and died shortly after, so I'm not really sure if you would call that a success. But now this year, we're going to be doing it on a human for the first time ever. Back in 2015, an Italian neurosurgeon said that the procedure might be possible now with the improved technology and more accurate ability to keep the neural tissue perfused with blood. He intends to perform this procedure by the end of this year after spending 30 years of researching. This will be absolutely amazing if this is successful, and think of how many people can be saved. Anyone who's paralyzed, who needs a new body, you just take their head and just pop it on a new one. But obviously it's way more complex than that. Well, thank you guys so much for watching this video. There was a whole lot of learning and a whole lot of complexity in there. Thanks for watching this top 10 video, and I'll see you guys very soon in a new Most Amazing Top 10 video. Bye.